right, we'll call the meeting to order. We'll start with the pledge. Or do you, should we move on to the next item?
That's up to you. I'm the only one with a flag, I think.
Well, I'm looking at yours, Jeff, so let's start out with the pledge. I pledge allegiance
to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
There, I didn't go too bad.
Got disjointed, but not bad.
All right, we'll approve the, is there, everybody had a chance to look at the agenda? Is there any additions or corrections? I know, Jeff,
Yes.
you wanted to add the action item.
Yep, I have one correction and one addition. On action item 2, it's quotes for the annual bridge maintenance, is what that should say. And then we're adding action item 3, which is consideration of the exclusion of the sheriff's office employees for the paid sick leave and expanded family and medical leave pursuant to the Family's First Coronavirus Response Act. That's a mouthful. So.
Okay, everybody's had a chance to look at the agenda. Is there a motion to approve the agenda?
I have one little minor change. It's April 28th instead of 24th.
Good catch, Teresa.
And that fix, thank you.
I'll make a motion to approve the agenda.
Is there a second? Bob, you're still muted.
All right, and just because we are recording and remote, we'll go through, and for Greg, our new member, we'll go through each district on each vote. So District 1?
Yes.
District 2?
Yes.
District 3? Yes, I thumbs up, yep. Okay, District 4?
Yes.
And District 5?
Yes.
Thank you. Motion passes.
Okay, now we'll move on to the previous board minutes from April 14th board meeting. Everybody's had a chance to review the board minutes. Are there any additions or corrections? If not, is there a motion to approve?
So moved.
Is there a second?
Second.
Okay. Any more discussion?
I think I caught Jeff on a few things and he corrected them immediately, so.
Yep.
Is the corrected version was
Yeah.
just a couple of small things, or?
Yeah.
Yeah.
Yep.
All right. Go roll call vote.
Yep, District 1?
Yes.
District 2?
Yes.
District 3?
Yes.
District 4?
Yes.
And District 5?
Yes.
Passed.
Now we'll move on. Now we'll move on to the April 21st workshop session minutes. Everybody's had a chance to look at those. If there's no corrections or additions, is there a motion to approve those minutes?
Motion to approve.
Burns.
Is there a second?
I'll second it.
Thank you.
Okay.
District 1?
Any more discussion?
Sorry.
Any more discussion? If not, we'll go with roll call.
Sorry, got ahead of you there. District 1?
Yes.
2?
Yes.
3?
Yes.
4?
Yes.
5?
Yes.
Passed.
All right.
All right.
Now we'll move on to public comment. Is there anybody online that would like to have a public comment? If not, we'll proceed to our first appointment this morning. Krista Ross, our Executive Director for Selco.
Good morning, Chairperson Johnson, Commissioners, Administrator Babinski. I'm Krista Ross. I'm the Executive Director for Selco, the regional public library system that serves Houston County. The Houston County Directors and I are pleased to be with you today to share some statistics about library services and begin the process for a new 3-year contract. Since there are new faces on both sides, we thought we'd start with introductions. Stephanie, I think you were going to start.
Hi, I'm Stephanie, and I'm at the Caledonia Library. I joined in October. My previous experience is in event management and, I just cut out there, is in event management, and I was also GM for the Green Mill for quite a few years. And I'm excited to be part of the library in Houston County.
Hi, I'm Kirsten Plummer. I started volunteering at the La Crescent Library back in 2014, I think it was, and have been employed there twice over the past several years. Last fall, I was hired as the HOCA Library Director. I live in La Crescent, where I enjoy hiking in the bluffs and other outdoor activities.
Hi, I'm Liz Gibson Gusset, and I've been the library director in the city of Houston for about 20 years now.
And my name is Dawn Johnson. I'm the director of the Spring Grove Public Library and have been for about 10 years.
Hi, I'm Casey Gent. I apologize again for the lack of video. I know I was hoping to show my face, but I started at the La Crescent Library. I took over the director position in October of last year. It's my 4th public library that I've worked in. Most recently, I was the adult services librarian for almost 4 years at the Sparta Free Library over in Wisconsin.
Okay. Now, Kirsten will share our statistics with you.
Hi, I'm glad everyone can hear me. So I hope you all received a table of statistics from the last 15 years, along with the chart that shows our data more clearly. Some of this data is pretty self-explanatory. Our circulation numbers are divided into 2 categories, electronic and physical. Physical circulation is just what you think. It's things like movies, books, snowshoes, any item that physically. Items include downloadable ebooks and e-audiobooks from our 2 apps, Libby and Overdrive. As you can see, electronic circulation has rapidly increased over the last few years, and we expect it to increase even more this year due to the coronavirus pandemic. In the coming months of financial difficulty, our communities will be increased needs for free resources. Some of those needs might include computer and internet access as people look for employment, or children's educational materials, or movies for hardworking folks who can no longer afford Netflix. All of us want the best future possible for Houston County, and so we look forward to partnering with you and our city leaders as we meet community needs and rehabilitate our local economies together. Thank you. And next up is Liz Gibson Gusset, Director of the Houston Library.
Hi. So we're trying to make it short and sweet for you this morning, and my job is actually to present our proposal for a new 3-year contract between the 5 Houston County public libraries and the county. And the handout you have is up on the screen here that shows not only the requests we're asking for 2021, 22, and 23. It's a standard 3% cost of living increase that would bring your dollar contributions to the amounts you see on the screen. And as you deliberate this request as a group, I'd also like you to consider some of the other information that's on this chart here. On the chart, you see not only the funding the county has provided for each year dating back to 2006, which is when I first started keeping track of this for us, but also, and I think more importantly, how that dollar number translates into per capita support from the county for the library systems. And for those who are new, I know Teresa and Jack, you've been through this a million times, but we do have some new faces. So per capita county support is really a calculation we make of the dollars that are contributed by the county to the 5 public libraries, divided by the total number of residents in Houston County who either live in the country or they live in a city or township that does not host a library. So examples would be, Money Creek, Sheldon, Eitzen, Reno, Brownsville. So the current population of Houston County, which is around 19,000 people, it's 7,926 people who actually fall into that category of what we define as a rural population. So our joint goal, as you can see here on this chart over the past 14 years that I've served here, has been to bring up the county's per capita support. And if you look at this chart, we have actually done a very good job. Back in 2006, the average per capita support from the county was $10.66. We've managed to, pretty much double that per capita support in the 14 years here, and continue to do so according to our 3% cost of living increase proposal. However, I think we do have to consider a bigger picture because one of the ongoing issues we have with library funding is really the very startling difference between the per capita support that cities that host libraries offer to the libraries and where the per capita support is from the county. So if you go to, oh great, the next handout is right up there. If you look at this sheet, this is from 2019 statistics, obviously. The cities in the Selco region, we're an 11 county region, the cities that host libraries, we look down at the bottom, they have a per capita contribution of $51.83 as an average. You can see where Spring Grove, Houston, Caledonia, Hoka, and La Crescent fall into this. I've highlighted them, but I've also pulled them over on the right-hand side on a separate chart and showed you what the city's contributions are and what the per capita contribution is. And you can see that there's quite a range with Caledonia on the low end and Spring Grove at the high end, but our average is $42.26. And that's where we see that Houston County's per capita contribution from the first handout I was referring to is a long way away at 19.83%. So despite the tremendous progress we've made in 14 years, the moral of the story is that all patrons in Houston County who walk into the doors of one of our public libraries receive the same service, but they do not equally share in the costs of funding our libraries depending on where they live. And this places an unfair financial burden on the residents of the 5 cities in Houston County that host libraries. Some are paying twice as much as citizens, and others, for example, in Spring Grove, almost 4 times the contribution that comes from someone who lives in the country or in a city that does not host a library. So, looking at these statistics, if you actually calculated out if the county provided the same level of capital support that, for example, the city of Caledonia is, your contribution for this year would be about $217,000. If you moved up and used a statistic from Spring Grove, which is an $80 per capita support, your contribution would be about $640,000. Now, obviously, we are not requesting $640,000, nor are we requesting $217,000. We're asking for a standard 3% cost of living increase for 3 years in a row, and obviously, this increase will not really cover our predicted increases to expenditures. At my library, for example, from 2017 to 2020, we saw a 29.38% cost in technology, and books, movies have increased as well as personnel costs. But while we would love a more dramatic increase, the truth is we're coming to you at a very uncertain time, and we have adjusted our expectations as a group as we all get through this crisis together. This very bare bones budget request is going to be covering the next 3 years as they unfold with the economic ramifications and the social issues that are going to be dealt to us all by the coronavirus pandemic. And one thing that we know for sure, what happens to libraries during economic recessions? We have increased usage of all our services. You can go back to that very first chart that Kirsten referred to. You can look at what happened after 2008, 2009, during the flooding here in Houston County. We see dramatic increases in the services that we're offering. And on that note, when I first started working for the Houston Public Library, services were very much come in, check out a book, check out a movie, and leave. Over the course of 20 years, we've seen a dramatic shift in what the population expects from libraries, and those services are everything from increased programming, classes, author events, teaching people how to use the internet, set up email accounts so they can fill out job applications, file unemployment, do the census. These are much more labor-intensive tasks that we're required to do, and they also require more expensive technology to support them. Certainly we are in the business of providing recreational books and movies for people, but more and more we are serving what I would call disadvantaged or vulnerable populations the older people in our communities, the younger people in our communities, those who are unemployed. As we move into this recession, we know that this is going to be an issue for all of us for the next 3 years, is how we're going to adapt our services to the new needs and meet the needs of our community as patrons lose their ability to have the internet at home. They give up their Netflix or their Hulu services, sometimes even their smartphones, as they run out of ink in their printers, as they are looking for free and fun activities for their children that don't require driving or admission fees. So we're currently all in the process of setting up new services such as curbside service, home deliveries, online programming, virtual story times. We're also going to be busy disinfecting materials and quarantining them. We have some new challenges coming at us. We don't know what those are going to be exactly, but we do know that we're going to need your support to make them happen. And we believe that you get a good bang for your buck with every dollar that you give to the library systems. Our hope is that you will approve this request with not too much further ado, and that we can get back to our jobs of serving the public. But just in case, Krista, I believe, is going to go over a flow chart for those of you who are new to this process, whether on our end or on your end as county commissioners, on how we finalize negotiations as a group and the timeline we need to do that on, so that we can respect our August budget processes. I just want to say thank you so much for meeting with us this morning under these conditions. If you have any questions for us right now, we'll be happy to field them. If you come up with questions later on, I believe we decided you could direct those to Krista, and she would give them to us as a group to answer and get back the information to you. And one thing I would like to reiterate, because I often see in the newspaper after these meetings that this money is going to Selco. It is not. Selco is an administrator of these funds. Every penny that the county gives back to us through this contract goes to library service at one of your 5 libraries serving your residents. And my hope is that we can work this out quickly and come to a conclusion. And I'm going to turn it over to Krista, but certainly if you have questions about the statistics you've seen today or our current programs in the library or anything that's going on, just let us know. Thank you.
Thanks, Liz. I have a flow chart that we created. This is something that we do only every 3 years. So even if you've been a long-serving commissioner in Houston County, you only do it every 3 years, and the process changes sometimes. So we see at the very beginning, this is the beginning of the new 3-year contract. And the contract that we have expires on December 31st of this year, which is why we're here now, partially because of the budget process, but partially because so that we can get the process started. How it's worked in the past is the contract requires that the librarians share those statistics with the county. We do that, and then we make our proposal for an increase for the next 3-year contract. We do know that you cannot act upon it at this meeting, so at the next meeting, typically that's when the commissioners, when you will look at the proposal, and then we kind of go into different things. If the library proposal is accepted, we are notified of that, and then Selco will create the new 3-year contract, which is pretty much the same language with the new dollar amounts put in. We will send you copies for every signatory. So in Houston County, that would be 7 copies for your approval and signature, and then those come back to Selco, and we make sure that all the other signatories get signatures, and then everybody gets a fully executed contract with original signatures. That's why we do so many copies. Should, when you meet, you decide that you would like to do a counter proposal, that would come to us. I will meet with the library directors. We talk about the counter proposal. If that's accepted, then we go on back again to the 3-year contract. Should it be rejected, that's when we would go into small group negotiation. And typically that's been 2 county commissioners, 2 library directors, 2 city administrators, and then the executive director from Selco is the Selco representative. And that group meets once or twice to negotiate and come to a consensus upon the increase, and then we go to the process. So that's been the process, and is pretty the typical process that we use when we need to create a new contract. So any questions?
Yes.
Hi.
Hi. Just The 5 county libraries divvy up the money, stays in the county. How is it divvied up between the 5?
They use a formula that is based on circulation and, can you guys help me with this? I haven't.
Yeah, absolutely. What we do is we divide it up according to the rural usage. So in effect, your money is going back to reimburse the libraries for services that in some ways have already been given to your rural users. We take a 3-year, I'm going to put my glasses on for this one. It's allocated based on a 3-year average percentage of rural circulation. So we separate out the circulation that went to residents from cities that host libraries. We take the remaining and we divide it according to the percentage that each of our libraries had. Does that make sense?
No, thank you.
Mm-hmm.
So how does that come out then with those rural calculations? I mean, can you give a percentage or?
Sure. The 3-year average in 2018, which is the most current statistics I actually brought with me, if that'll do for you, Caledonia had 20.97% of the rural circulation that year, so they received 20.9% of the total budget that was allocated to us by the county. Does that make sense? Moving down, Hoka had 7.78, Houston had 32.92, La Crescent 26.54, and Spring Grove 11.74. And those numbers are all over across the board, obviously, but if you look at a city, for example, La Crescent has done a lot of annexing of rural territories that have now become city. That's reflected in their budget increases that they've had then. Casey, jump in here if you want to. But also the geography of where a city is located makes a big difference. Houston, for example, and Caledonia have the advantage that they are surrounded entirely by Houston County, whereas Spring Grove is right on both a border to another county and a border to another state. La Crescent sees this also. They have the river and Winona County just above them. So it is, we consider that the money goes where the feet go, that the feet are the voters, the items that get checked out to rural voters, that's where your dollars go back to reimburse the library for service. Did I cover that clearly enough for people?
So you mean more or less that wherever the most traffic is, that's where the most money is going to go?
Well, specifically the most traffic from rural Houston County.
Rural. We're talking only rural.
Yeah. So for example, in La Crescent, I have a substantial number of my patrons who actually live in Winona County. Those numbers do not count toward this process. When we divvy up the money from Houston County, anyone who does not live in Houston County does not count in that process. So it's where the feet go, but it's only the Houston County rural patron feet.
Right, and again, rural in this case is defined as someone who lives in the country or lives in a city or township that does not support a library. So there's a specific definition to what rural means there as well. Is that clear? It's something we talk about all the time, but I know this is, something that, as Krista said, only comes up every 3 years for you.
So this company, Selco, that does all this lining up, who pays them, or how do they get paid?
Selco is one of 12 regional public library systems, and about 60% of our budget comes from state aid called Regional Library Basic System Support. Another about 40% comes from fees that our member libraries pay for specific services.
Okay.
Well, 3 years ago, Steve Schultz and I were on the 2 commissioners for negotiations because at that time, we had a 0% levy and we could not afford the 3% increase. We're having problems coming up with a 3% increase again because of all the expenses that are coming because of this virus pandemic. I'm wondering if we should have 2 commissioners meet with your board again and kind of talk this through and then bring it back to the board for a decision after we explain our side where we can't possibly afford the 3% increase.
Well, I think that'd be we don't have to make a decision today, so that we can discuss this further as a board too.
Yes.
When is the deadline for this?
The contract will expire on December 31st of this year.
Right, that's, yeah. So we have a little time here to discuss this and talk it over.
Right. I think there are budget deadlines too that are going to impact
Right.
first.
Right.
For both the county and the public libraries.
Yep.
So.
Yep.
That's part of why we begin the process. I think we're required by our contract to start the process at least 6 months before it comes to an end, in case we need to move into small committees.
Okay.
Yeah. So we definitely have some time. This being the end of April.
Yep.
Well, I would encourage you to, look over the statistics we provided, to see our rationale behind that, and to remember that, when you give dollars to the library, they're really serving populations that are going to be very severely impacted as we move forward in the next few years. In some ways, I think the library is on the front line of social services when it comes to, the daily lives of people, and every dollar goes a long way. So I hope you can meet this request. If not, we'll be interested to see what you come back to us with.
Thank you.
Yes. Thank you very much for your time.
Thank you.
Thank you all.
Oh, hang on, we've got another question from Commissioner Burns.
Oh, we got Bob.
With regard to you, Krista.
Yeah.
You can see your face. On the agenda is to vote to approve you, right? No?
No.
Stay on the agenda.
Right.
We're coming today, Bob, to give you information and also our proposal. It's for you to consider, get back to us, follow that flow chart. If it's as simple as saying, yes, we can, honor your proposal, then we're done. If not, you've got a whole process by which...
I'm not talking the proposal of the funding.
Oh.
What is Krista? Jeff, I'm going to ask you.
Yep.
When you read, and I can see this, and I don't have the means to copy my agenda.
Yeah.
What did it say?
Just had her listed as having an appointment.
Yeah. But is that an appointment
Not,
that each county has to make and each city has to make? Or, why is...
Jeff, you want to explain that?
not an appointment as in appointing her to something, just scheduled appointment. She had a scheduled appointment with the board.
All right,
Yeah.
There you go.
Bob.
Yeah.
This was just an appointment to hear Selco's presentation. So.
For the county.
Right.
Yeah.
I got it.
Well, I'm glad you took a drink of Bob.
It's clear. It's okay.
Although I'd be happy to help wherever I could help. If you need me for something, I'd be happy to help.
Okay. Are there any other questions for Krista and our librarians? All right. I see shaking heads rather than nodding heads for the commissioners. So Krista, thank you, and all of you for your time this morning, and we'll get back to you after discussion with the board.
Thank you so much for having us.
Thank you.
Goodbye.
Bye. Stay safe.
Thank you.
As well.
Thanks.
Okay, now we'll move forward with the COVID-19 update from Public Health. John?
Good morning, Commissioners. I see on the agenda that we're not an appointment, and I'm not sure if that's good or bad. So, good morning to everybody. Welcome to new Commissioner Myrie. I look forward to getting to know you and giving you some background information on public health and human services, but welcome to the board and congratulations. Today we want to give you just a brief overview of some of Houston County Public Health and Human Services response to the coronavirus COVID-19 crisis. I think you can see different things in the news, obviously, and we want to let you know some of the things maybe that you don't see that are going on in at a local level. Hang on for 1 second. If you have, they're doing carpets outside my door here, and it sounds like a jet airplane is going by.
I was flipping through trying to figure out who I needed to mute, so I guess it wouldn't be you.
There we go. Sorry, I could hardly hear. So could you guys hear all that?
Yes.
Yeah. Okay. So I'm going to give a real base overview here, but I want to provide opportunity for Heather Myrie and Audrey Stegemeyer, two of our key people in public health in this response, to share some things with you as well. Jeff forwarded a 2-page document that kind of highlights some of the high points of our response. What I want to do is kind of talk a little bit about, we have some core values that we want to abide by in our response to this or any other emergency within Houston County. Early on, we saw this as something that had quite a bit of potential for issues at a national, state, and local level. And we wanted to make sure that our responses and the information that we were putting out there, both to the board as well as to the community, was fact-based, vetted, scientific kinds of information. And so, you know, we want to make sure that our response is consistent with that value. Another value we have is timeliness, and yet timeliness can be a real challenge in a world of social media. The social media around the COVID-19 crisis is massive, and staying ahead of that curve at a large national and state level as well as a local level is a real challenge. In order to do that, we've established certain strategies that Heather and Audrey will be talking a little bit more in depth with you about. I just want to make sure that I highlight the good work that those two are doing. We're in good hands with people in Houston County who have a very good grasp of the importance of the public health side of this, and I've just been very impressed and encouraged with their work. You know, another value that we've had is we want to be careful in how we as public health weigh in communicating, either through our website, through press releases, through social media, things like that, or even we get many requests for information via the telephone or emails, and we want to make sure that we're staying consistent with the value of giving scientifically vetted factual information, and also kind of not stepping out of our role and speculating on things that really, you know, we don't have an epidemiologist on staff, so there's certain things that we're just not qualified to be able to respond to. Or even different things, there's been a myriad of different issues that people come to us with, things that they are concerned about in relation to the governor's executive orders, people who are perceived to be violating stay-at-home orders, things like that. We want to make sure that our response to that is vetted with our state partners. And sometimes that means that response isn't as quick as we would like, and we've kind of erred on the side of saying, you know, we want to make sure we give the right answer rather than a poor answer done very quickly. I guess the big thing that we have been saying, and an important thing that I encourage you guys as county commissioners to continue to share with your constituents, is that while you look at the map of Minnesota and you look at Houston County, we have one lab confirmed case in Houston County. The counties around us, with the exception of Vernon County in Wisconsin, all have significantly more lab confirmed cases. That one lab confirmed case is not a good indication of what our risk is or what's going on with this virus in Houston County. And it certainly isn't a good indication of the magnitude of what's going on in our response to this in Houston County Public Health and Human Services. This has been a massive thing, and in my career, I would say that I struggle to find something that is comparable. Really, over the last couple of months, COVID-19 has sucked all the oxygen out of the room. And if you look at the fact that there's only one confirmed case, you may think, well, it hasn't been that big a deal in Houston County, and that just isn't the case at all. Right now, the Minnesota Department of Health has been saying that they are estimating that confirmed cases represent in the neighborhood of 1% of the true number of cases in any given county. For us, that means that we're probably in the neighborhood of 100 cases, if not more. Another thing that's been challenging for us that both Heather and Audrey will probably touch on as well is the fact that we don't have a hospital in Houston County means that virtually everybody who's tested for COVID-19 is having that be done outside of the state, most in the state of Wisconsin, some in Iowa. And so that process of information is slow at best. But people in our county have access to things from La Crosse County or from Decorah, and they have friends and relations in both of those states, and the data sources that the state of Wisconsin has or the state of Iowa has are different than how Minnesota is reporting things. You may hear that we are not reporting the number of negative tests in Houston County. Actually, that information is not available anywhere in the state of Minnesota. They'll show you what the negative tests are statewide, but not on a county basis. So some of those challenges in different jurisdictions here as we border two other states is unique to Houston County, and also unique in that we don't have a primary care hospital in Houston County. I just want to highlight again, the people who are responding to this in our public health division are doing an outstanding job. I want to give them time to go through these two documents with you, but I appreciate your time, and I thought that it would be helpful for you to kind of get a sense of what we're doing in response to this over the last several months. So I'm going to hand it over to Heather now to walk through some of this document with you.
John, before you do that, John, can I ask you a question?
Sure.
So you don't know how many tests were taken in counties in Houston County? It's just a statewide number. Is that what you're saying?
Yeah.
Okay.
And one of the things that's hard about that is virtually all of ours are tests are being done outside of state.
Yeah.
So I'm getting a weird echo. I don't know if you guys hear that.
No, you're good. You're good now.
Okay, so if tests are done outside of state or in Wisconsin or Iowa, they send that information through the Wisconsin State Public Health process and then to the Minnesota Department of Health. And all we're getting from those states, as I understand it, is the confirmed cases. Some of our cases may have eventually or potentially have been done through the Mayo system, which goes to the Mayo Clinic in Rochester. But all that being said, the state of Wisconsin and the state of Iowa are not sharing the number of Houston County tests that are being done. So we've talked to MDH about this and said, we border states that have a different set of data points that our constituents are wondering why we're not sharing that. And that information just isn't available, is what we're told. So, and I think largely it has to do with the fact that those tests are mostly being done in other states. Does that answer the question?
Yep, thank you, John.
Yeah.
John, I have a question also. On the one confirmed case in Houston County, can you share information as to where that person may have contracted the disease?
I don't know that I can share that information. I don't know that it's public information. That's also been a pretty challenging aspect to this, in that we have outstanding people in law enforcement and emergency response, EMTs, and I have felt strongly that we should be able to share information with those EMS professionals and law enforcement when we have positive cases. And I think that that's been the feeling across much of the state. However, the data practices requirements with the Department of Health have really put us in a position where they don't allow us to share additional information. Much of the information that would be helpful, we don't even have. One thing I can say about that case is it is an individual who has since recovered and is no longer receiving any kind of care and no quarantine to speak of. So, I don't know, does that help answer that question?
Yeah, it does, but I'm just, you know, the Winona situation really skews this regionally with their 8 deaths. When you look at where they occurred, it really doesn't show a true picture of the outlying areas where it continues to be the scarcity of cases remains.
Yeah. Jack,
I think that in the region, obviously, recently the Department of Health started sharing information about long-term care facilities that have multiple active cases, and that gives us a picture, as well as situational update information on the MDH website shows that a high percentage of cases and certainly of very serious cases and fatalities are connected to long-term care facilities. I don't know that I'd agree that it indicates that everywhere else is scarce. I looked to a county to the west of us where they were reporting 1 case for quite some time, but also had a meat packaging plant, and their cases exploded over the period of just several days. So somebody's showing Iowa there for us.
yeah, John, this is Jeff here. I just wanted to pop this up. I sent out information last week that showed Allen McKee County having 44 cases. What I didn't pick up on was that was 44 active cases. If you look at Allen McKee, they actually have had 72 confirmed cases. And what's telling and much different than what we're seeing up in Winona is when, nice thing is they're up at the top alphabetically here. When you look at their actual case count by age of population here, that age range in Allen McKee runs from children, adults, middle-aged adults, older adults, and not into the elderly. So that's out in the wild, that's out in the population, that's not contained to a nursing home.
That's helpful.
I have spoken with the Department of Health in Minnesota saying, you know, some of this type of data would be helpful. The other challenge, the other side of that coin, is the smaller your county, that information, the more granular it gets and the more specific it gets, the more easily it is to be able to identify specific people. And so I think that's driving a big part of MDH's response. But I do think that some of the challenges that we've experienced here in Houston County are driven by the fact that we border 2 states, and our citizens are going out of state for much of their health care.
I have one question for you.
Yeah.
Now, this testing that you're talking about, is this voluntarily, or you gotta go in? Are we testing the nursing homes and assisted livings in our counties? Are we doing anything like that?
Up to now, testing has been very scarce, and that's one of the things that I really try to stress with folks is that our number of 1 confirmed case is not a good indication of risk. It is, however, a good indication of access to testing. Much of the testing resources in the state of Minnesota have been focused on either people who are very ill in the hospital or long-term care facilities. In Houston County, since much of that testing is done in Wisconsin or Iowa, I can't really comment on that. Heather, do you know about long-term care testing?
say that number one, yes, Greg, it is voluntary. I don't believe it's mandatory unless there's a employment component to that. If it is in a long-term care facility, the testing is also geared towards the high-risk populations in long-term care facilities, but also the essential frontline healthcare workers who are working with individuals potentially exposed and caring for those individuals. So that is also a target group for these limited testing kits to be available to test them as they continue to provide care. Does that answer your question?
Yep. Yes, it does.
Okay. Yeah. Are there any other questions? I'll just kind of provide a brief highlight. Thank you, Jeff, for putting that up on the screen. I don't necessarily want to read all of that to you, but if you guys have any questions as I go through it, just feel free to interrupt and ask that. But, you know, the public information outreach, you know, we've had a lot of interaction on our Facebook page. We were, I would say, early on, one of the earlier counties in the state actually to have information on our website regarding COVID-19. So we wanted to be a source of information for the public on that. And what comes as a great resource in getting information out quickly with social media, it's also an avenue for individuals to speculate and do things like that. So there is a thing of kind of housekeeping that comes along with that that's important to do. Looking at our regional partners as we move along, you know, we're connecting with our regional epidemiologists through MDH on a regular basis. We have regional healthcare partners. Wisconsin, we've been communicating with them a lot. We're part of a La Crosse County consortium of public health partners within about a 5 or 6 county region across the river. Because our residents do access care across the river, it's important that we maintain close contact with those healthcare partners when it comes to that. Community partners, we with long-term care clinics, schools, prior to schools being closed by the governor for distance learning, food shelves, daycares, law enforcement, EMS, we're really trying to be a resource and an engaging partner with all of them as we try to be planful with our response efforts to the best of our ability as resources allow. We have our virtual EOC, you guys are familiar with that, and then just our daily operations and how you know, we're trying to, as best we can, continue all of our services. However, we have to deliver those differently to people. You know, sometimes with WIC, that might be a curbside drop-off or pickup of, you know, a medical formula that an individual needs. So we can't ask them to go without that, but we just have to be creative and do things differently while trying to maintain our social distancing to ensure the safety of our staff and ensure the safety of those individuals in the community that are potentially high risk. Yeah, go ahead. I'll pause.
I wanted to add something to that as well. So our daily operations for public health and human services have been deeply impacted by this. And, you know, Heather mentioned it, and it's been a big part of how we've managed this over the last many weeks is how do you balance an essential services mission that the people of Houston County rely on, Houston County Public Health and Human Services, and often the most vulnerable people in our county rely on us. How do we balance that need and those essential services that we're here to provide with also keeping our staff healthy and able to provide those services? So as Audrey gets into a few of the things that we did at different points of time, as far as having some of our staff be working from home, trying to preserve workforce, and also recognize some of the inherent limitations we have with data, I don't know, for lack of a better term, kind of the data pipeline coming in and out of the county. If we had everybody out, we would easily inundate that and not have bandwidth available for other critical services in the county. So it's been this delicate balancing act that we've tried to strike. We also have staff that have certain unique challenges because there's people either themselves or people in their immediate family that have some of the underlying conditions that put them or their family at much greater risk. So we need to balance some of those interests as well. And it's an ever-changing picture. We don't know everybody's specific circumstance, and they don't all disclose it all on the same day. So it's been evolving over time. We've also worked very closely with the HR office in implementing some of the unique leave strategies that have come to us from the federal and state government. So when you see that list of daily operations, we are providing the services that are core services for public health and human services in many ways very differently, and yet trying to do as best we can to meet those critical needs. So I'll turn it back over to Heather unless anybody has any questions on that.
Yeah, I was kind of wondering there, like, how far out is it? That's a stupid question.
Teresa, did you have a question?
Greg? Yeah, Greg is talking right now.
Oh, I can't hear.
Go ahead, Greg.
Say that again. I had my volume turned down because I was echoing.
It isn't a very good question, but I was kind of wondering what your thoughts and Heather's are. How long or how far out is it before we'll have testing in our clinics around here?
What I will say with that is, right now, to my knowledge, I believe the main clinics have pulled their clinic staff back and closed local ones. So I think at this point it's a matter of test kit availability, not necessarily staff to administer those. The other thing that goes along with the test kits and their availability is, we could have, 2,000 tests that they say, here you go, Houston County, you can use. But what happens is all of those tests still have to be processed, and what they run into at the state lab at MTH, as well as other private labs that are working on processing these tests, is they run out of reagents to process those tests effectively. So if they need X number of reagents to run this test and they run out of one of them, the whole process halts. And they had the backlog of thousands of tests at MDH a number of weeks ago, and then until the replacement reagents came in, they couldn't process any of those. So when we, and MDH lets us know about that to the point where they're going to see spiking cases because now we have reagents back. So that's not necessarily a spike in brand new. They all were diagnosed the same day. It's just all these tests were processed in a very short amount of time. But to answer your question, Greg, we aren't sure when we're going to get tests specific in Houston County. If we hear anything about that, we can certainly share that as we are as we're made aware. But to my knowledge, that would not come through necessarily public health. It would be on the healthcare side, which again is another layer because their kind of home-based clinics are in Wisconsin, so it's just different.
Hey, Heather.
Yeah.
I just have little notice something that we can only see the top of your nose and.
Oh my God.
There we go.
Sorry, it looks okay on my computer.
You have beautiful eyes, but that's all I can see for a while.
That would be a little distracting.
That's a minor detail. Now there you go. Perfect. Thank you.
Are there other questions that commissioners that you have with regards with what I've shared, or John, before we have Audrey go through that timeline briefly?
Yesterday I listened to the webinar from Governor Walz, and he is really looking for funding for the county's public health to be able to do some testing and process the testing kits. And then he brought out that if somebody tests positive, that they're put in quarantine at this time for 14 days because we don't have a vaccine at this time. So this would go on until there's a vaccine available as far as the treatment. Quarantine until there's a vaccine. But he was really pushing a lot of local public health to be able to provide this service with funding, which at this point there isn't funding. Have you heard about that?
I'll try to take a stab at that initially. One thing perhaps you guys all noted last week, the governor announced a partnership with the U of M and Mayo Clinic to significantly increase testing. as that is ramping up, we're going to see more positive cases, presumably. Part of what is necessary at a local level is what they call contact tracing. And so, say somebody is identified as a positive case in Houston County, there just isn't enough people in the Minnesota Department of Health to go and contact all of those people who have tested positive and then kind of find out who they've been in contact with to give them direction on how they should behave or whether they also need to quarantine to hopefully slow the spread. That's a significant thing to pay attention to, and as we were going to talk a little bit about from here into May and beyond, that's something that has a high potential of having a local role, and we're just beginning to look at that and see what our potential is, what our capacity is. But that would be a massive undertaking for any public health agency, and so it's something that we have our eyes on. We watch the email every day to see if we have additional new cases, and we're obviously watching our situational update from MDH as well as the updates from Wisconsin and Iowa. And at this point, obviously we haven't seen a significant spike, but I would anticipate we're going to see more cases both in Houston County and across the region and the state, and we'll need to be continuing to partner with MDH and what that brings to us. Anything you want to add to that?
I just wanted to add that the email John's referring to is our first case we were notified was a phone call, and subsequent cases, and we will be notified. Counties are notified via email. That email comes anywhere between about 5:30 p.m. to 6:30 p.m. every day. So it creates a little bit of angst in my house anyway, because it's really an email you do not want to miss. We can't afford to miss. So you kind of start thinking about losing sleep with that, because if we miss that and then information shows up on the situational update, then what we do is we end up playing catch up. And that's something we don't want to do. We want to try to stay ahead of the information. When we get notified, we want to be sure that you as a board are notified of that prior to information being released. So sure. So with the first case, we did the press release. The second case, when we get that, because we know that it's coming, and I'm just kind of stunned it hasn't yet, but we will also be notified. We'll notify you as a board, but then that will be a press release. But then additional, any subsequent cases, 3 on up, we will be just posting those numbers to our Facebook page, like a Facebook account. In the beginning press releases, it was a little bit more novel information as cases were popping up, and we're the only county without one, and then we got one. So trying to respond to those requests and kind of funneling that traffic to our Facebook page has been, I would say, the way we can update that very quickly in real time, and then refer people to that resource, as well as we've done a Q&A, incorporated a Q&A on there as well, with questions on social distancing, questions on can we get together for Easter. We try to have real timely things that seem to be come out from Governor Walz's different addresses that he has made, to make sure people in the public are interpreting that information accurately and incorporating it into their life to slow the spread.
Heather?
Yes.
Yes, this is Jet. Where does the email come from?
Where does it come from?
Yes.
It comes from MDH. It comes from MDH.
So say somebody is the second one. Who contacts MDH? I mean, if
So
they're...
I'll just use myself as an example. So let's say I go in today and I get tested, and I'm positive, and I'll just say it's at Gunderson, because that's where I go. Gunderson, then they send that lab confirmed test to their state lab of hygiene, the Wisconsin Public Health. So they send their test to the state, the lab confirmed positive. That then has to get communicated to MDH across the river, and then that's funneled down to us in that way. So there's probably is an extra 2 days in there where the relationship that we can try to continue to strengthen right across the border will hopefully enhance the speed of what we get that communication. So if they can send it to us at the same time they can send it to the state, at least we can be in communication with our regional and state people to be on the lookout for that. But as far as releasing that information, we do need to wait for the email from the Minnesota Department of Health and their response team. Does that answer your question?
It does, thank you.
Okay.
I just
Any
wanted,
other questions?
I wanted to point one thing out quick. You mentioned the contact tracing, and right now with our size, we're a county where that contact tracing happens at the MDH level. In one of the governor's briefings, they mentioned that they had about 100 people doing the contact tracing for the state, and they were estimating needing about 750 people to do that. And the state was trying to ramp up and hire more folks to do that. But one of those things for the commissioners that we're kind of watching as well is at some point if the state puts their hands up and starts asking counties to help with that, that would certainly change our workload and focus for some of John's folks. So we haven't seen that coming down the pipe yet, but it's in the realm of possible.
Yeah, it's on our radar, and it's something that we're currently planning for right now, what that ramp up would look like. With maybe having just the one case, it's we can maybe live in a land where we have some time for planning, but we know that there's more cases, and we know that at any time we're going to get contacted about that, and the contact tracing is going to become a part of we're having to figure out what we're going to do with that and what our capacity is and what that means for staff. Yes, right now it is, Jeff, as you said, nearly 100 people, epidemiologists that do that contact tracing statewide. So it is a fairly significant undertaking. And when you talk about Houston County, our contact tracing would spill likely over into 2 states. It can become a little bit more complicated than maybe someone who's more centrally located in the state and can still be within state boundaries to do that tracing. Yeah, Audrey, do you want to just highlight some points on that timeline?
Sure. Yes, I'm Audrey, the health educator for Houston County Public Health. I work as the FEP coordinator, which is the Public Health Emergency Preparedness coordinator. So I've been in the daily operations and response to COVID-19. So this is just a brief overview of a timeline when it all kind of began, the response here in Houston County, and kind of where we're at now. I do have a more conclusive 8-page timeline that I keep on a daily basis to kind of what we're doing here. But before I go through this, I just wanted to quickly mention, if you have not checked out the Minnesota government COVID-19 website, I'd highly recommend it. It's mn.gov/COVID-19. They do have a lot of information on there that might be helpful. And one thing just related to testing is they do have a area specific for if you are sick. It goes through as a questionnaire and also lists testing locations that are currently going on throughout Minnesota right now. We don't have any currently in Houston County. The closest would be Gunderson in Unalaska. And it is also showing that Mayo Clinic in Rushford does have some COVID-19 testing availability. So go ahead and check that out. Just talk a little bit about the timeline. So it all kind of began here in late January. That is when a lot of the informational calls that I attend on a weekly basis began. So those were calls by local public health from the Minnesota Department of Health, and that was also broken down into a variety of areas. So there was a schools call, there was a long-term care call, just a variety of calls to provide information to us and our partners within the community on what the response was at that time and kind of what the status of COVID-19 was in Minnesota. So that all began at the end of January. In February, those calls continued, so I continued to attend those weekly calls, gather information, share those resources to our community partners. the goal with all this, as John had spoken about earlier, is to be able to provide accurate and factual information to our partners and also our communities. So I began in mid-February with informative information, so PSAs that were sent out to all our Houston County newspapers. Just basically general information about what COVID-19 was and what we could do to help prevent it. So like standard precautions, hand washing, staying home when you're sick, covering your cough. All the information that I used in our PSAs was directly from the CDC or MDH. So my goal in all the work that I do is to make sure that I'm using reliable sources that we're sharing with everybody. And then in late February, there was the update given by John to all of you commissioners, kind of what we were doing here in Houston County. So we had opened up a banner, or we added it to our public health website so that residents could go there to seek information related to COVID-19 in Houston County, and that also directed them to the reliable sources of MDH, CDC, where they could get information, up-to-date situational status, etc. And then we began posting information on the Houston County Facebook post. So Houston County Public Health Facebook post. So Public Health had a Facebook page prior to COVID-19, and I was operating that. It was, just posting information in general prior to COVID-19, and since COVID-19 has been here, it's been mainly a source of information related to COVID-19. So we posted our press release on there. We also post, as was mentioned earlier, we started a Q&A. So twice a week I post a question and answer related to COVID-19. Commonly used are questions that we get questions about, or just information that MDH is sharing that is very important. So I only use MDH, CDC, vetted, accurate information when I do those Q&As. So it's not anything that I'm just coming up with myself. So those have continued into this time. And then through the months of February, there was a lot of contact with community partners, schools, local food shelves, long-term care clinic, a lot of our partners, just to get that information out to them that I was receiving, or that we were receiving at Public Health through our weekly calls and our sources. So that brings us to March. So continue to attend those weekly calls. And we continue to update information on the Houston County Public Health website, and also on our Facebook page. And we did another round of PSAs to Houston County newspapers, and also directed them to the media site that MDH has, where they can get a weekly updated information related to COVID-19. So in March, Houston County, there was emergency declaration. And then in March 20th, Houston County offices closed to public access. And then on the 27th, Public Health and Human Services staff were given the option to work from home as a result of the stay-at-home order. While our offices are closed to the public, we still, as was mentioned earlier, are providing services to those that we serve within our communities. And then in April, we also continued to attend those weekly calls. And then our first lab confirmed case in Houston County was on the 5th of April. And so with the press release that went out, that was also shared on our Facebook page. And that reached, as you can see, a large number of people. So when we started in January, our current following on the Facebook page was about 200 followers. To date, we have almost 900 followers, and the biggest thing with that is even if someone doesn't follow our page, our followers will like or share our posts, and then that continues to be seen by other people. Hence why you can see the large number of reach with our posts. So we find that it's a very valuable source to get information out to the people in our communities. But since not everybody is on Facebook, we also do have that information on our public health website too. And then on April 6th, 50% of our public health and human services staff began working remotely. And that's also when we began the public health Facebook question and answer sessions, as was referenced earlier. And then also a weekly updates for case information. As mentioned, we currently only have that one positive lab confirmed case, but we do share every Monday and Friday an update on Facebook to let people know what the current status is, and if that were to change, we would also update at any given time. We opened a virtual EOC with our community partners in early April, and that consists of Houston County staff along with emergency management, and then some of our community partners like EMS, local cities. And that's just more of it happens twice a week, and we just use Zoom to be able to communicate what's going on, what the need is. A lot of things that are talked about on there include like PPE, or like the State of Minnesota Mass Drive. It's just a place to come together and share information and resources and address needs within those in our community also. And then that brings us to the end of the month here. But overall, and just a general in my response here, it's been a lot of weekly calls that I attend, and that information is shared with partners within our community. Currently, the biggest need right now is the long-term care, so I've been doing a lot of work with long-term care. Another thing is now that farmers markets will be opening up here in the near future, I've been doing some work with them. Otherwise, it's been fielding a lot of calls from businesses, long-term care, community members, and just responding to provide guidance to them by using state and regional partners. So as mentioned before, a lot of the information that is shared comes directly from the Minnesota Department of Health. So looking at May, we, now that there's the discussion for increased testing, we could plan for an increased number of potentially positive cases. And with that, there could be the need for essential services. And as local public health, we are responsible for providing an essential service to a positive confirmed case. And for instance, that may be expected to quarantine within their home, but needs some assistance with the basic needs like food. So that would be what would be considered an essential need. So we could see that happen. We haven't currently had to provide that to our one case, but that is potentially something that could happen in the future. And as mentioned, I've done quite a bit of interaction and work with our local long-term cares, because the potential for long-term cares or workplace or conjugate living setting outbreaks is currently a risk right now for a lot of communities. So just working with them on making sure that they have what they need, and that we can be a resource for them. And then as Heather had also mentioned, with the increase in cases, there could be the possibility that local public health is involved with that contact tracing and also patient investigations in the future. But I do have, like I said, a 8-page timeline that I have kept track of kind of the major happenings that have happened here at Houston County during the COVID pandemic, which I feel will be helpful for us when we look back on this. Does anybody have any questions for me?
I'll ask a question if I'm still on.
Yes.
With regard to, everything that you're talking about and that Heather talked about and John, everything it sounds like it's all geared towards the pandemic and whatnot, but what about the people are you experiencing a large increase in requests or demand from the people that lost their jobs, lost their insurance, that are affected by this? Even though we only have one case in the county, has your request needs and your capacity been drawn on as far as the people that are not affected by the COVID virus but are affected by the results of all the issues and whatnot?
I'll take a run at that, Bob. It's a great question. We're beginning to see the impact of people coming to us wanting to access some of the specific COVID-19 types of assistance that are coming to us from the state and federal government. Initially, we didn't see a lot of that, but I think as the stay-at-home order has extended and as people who are unemployed, the longer they are, the more they're reaching out to us. So our financial assistance division is getting more busy with those types of things. The guidance and how those programs work and how they interact with other programs is trickling in, and oftentimes not at the time that you need it to make eligibility decisions. So we're doing the best we can to get those programs administered. Some of it is going to be some cleanup at the end, and the state is, some of it is, they're yet to determine exactly the impact. For instance, if somebody had received, say, food support assistance and they're receiving some additional unique COVID-19 assistance, how do those two programs interact and affect the individual's eligibility for existing programs? Some of that we're trying to figure out and make sure that in the process we're still meeting the needs of people who have some pretty dramatic needs right now based on the economic impact of all the closures. Does that help get at some of that? Yeah. The other thing I'd mention is, we, as I mentioned earlier, we serve some of the county's most vulnerable people, and so there's people with a variety of different physical or mental health issues that they deal with, and these sorts of crises exacerbate some of those things, and so people's anxiety and concerns are heightened, and so our social work staff and our partners who provide mental health services have been very busy and very creative in trying to reach out and meet the needs of those folks in a remote environment. I've heard of a number of different creative approaches, and yet in many cases a face-to-face is hard to fully replace, and even some of the things that are really indicated or encouraged for people who have anxiety or different mental health types of things would include getting out more and interacting with people so that they're not as shut in. Well, this is not a time to get out and interact with more people, and so we're seeing some of those things that have implications with long-term well-being for people we serve.
I have one question. Yeah, that's great. All these businesses in Caledonia, bars and restaurants in the county, are you guys working with them on how to reopen so we're safe and we don't have another epidemic right away? Or is there some protocol they gotta go by? What is the plan of attack there?
Right now, the main plan of attack is driven by the governor's office, and as he and his office and the state government begin to turn the dial to reopening parts of the economy. So just yesterday, the manufacturing or office types of settings where there isn't a customer facing portion of the business were allowed to begin reopening. Each of those businesses need to have a plan in place with the state that shows that they have mitigation, what they're doing as far as social distancing, what they're doing for hygiene and all of those things. A lot of that is being driven by the state of Minnesota, and we haven't been intricately involved with that side of it. I'm guessing DEED has some impact with that, but it's really driven more by the governor's executive orders as to what is open or what's not.
I'd jump in quick here. I provided that information from that executive order to EDA, our economic development agency, and had her push that out to her list of companies. So we've tried to share that with the company contacts that we can, and then we'll be open to helping and address questions.
And I'll also add that on the Minnesota.gov COVID-19 website, they do actually have a section on there for employee employers and employees, and it has some guidance on there for opening up.
Thank you.
I'd also say that, you know, anytime somebody reaches out to us, we do our best to get information to them. And we've had people reach out to us from a myriad of different places, anything from people conducting auctions to different family events to just, you know, and so what we try to do is not respond and say, well, here's Houston County's response. We want to make sure that it's consistent with the state, Minnesota Department of Health, and the governor's executive orders.
I've got a question about, so if MDH comes to you, to Houston County, and all the other counties, and wants you to do these contacts, information, and sourcing, and all that stuff, how are we going to handle that as far as staffing and workload? Is that I'm sure that's a concern on your part, but.
Well, it's a huge concern on our part, and I think that it is. I'm hopeful that it isn't going to be something like they give us a call today and say you need to do 100 of them tomorrow. I think we'll see that coming and starting to ramp up, but we're in the process of having conversations and talking about that internally. Heather alluded to a little bit of this before, but there's been emergency preparedness plans in place across the state in different counties for years, and presuming that there's some sort of an outbreak of different things, counties opted in or out on whether they would be doing contact sourcing and patient investigation and such. Many counties opted out of that. Some of the larger counties opted in. And so that's kind of the network that they're working with right now. But as the numbers of this grow, the state is indicating that they may need to reach out to counties that even opted out of those things. And so to answer your question, Eric, we're closely watching that because our ability to meet those needs would be somewhat minimal based on our current staffing. But we want to be a partner and we want to be part of solutions. So that's a developing story that we're going to see in the weeks to come.
Thank you. Any more questions from anybody else, or? If not, thank you, John and Audrey and Heather.
You bet. If you guys have any questions at any time, feel free to contact us. And thank you for the time you gave us today. I hope you have some indication of the response that we're doing on a daily basis here. Again, if you have questions or people contact you, constituents, feel free to reach out and we'll do our best to support you.
I have one more question. I see a similarity in names between Heather and Greg. Is there a reason for that?
She married a Myrie. I can't help that.
So if we see a request for a big pay increase from Greg, we can understand why that may be.
I hope not. That will never happen.
All right. Thank you. Thanks very much. All three.
Thank you all for your good work.
Thank you, Commissioner.
Thank you, guys.
Last comment on that topic, what didn't come up in there is our sheriff has been receiving a number of phone calls over the last week or so. Everyone seems convinced that the sheriff has the authority to authorize businesses to go back to work, authorize birthday parties, Christmas, holiday parties, etc. So he has taken a number of those phone calls and politely pointed people in the right direction for that information. So.
Good point.
Sharing that too. Okay, I'm going to turn this because we're going to get into some HR stuff, and Tess is here with us as well. So back to you, Eric, for the agenda.
Consent agenda?
Yep.
Okay. Everybody's had a chance to look at the consent agenda. Is there anything in that consent agenda that would like to be pulled out or discussed? If not, Is there a motion to approve the consent agenda?
I'll make a motion to approve the consent agenda.
Is there a second?
Second.
Any more discussion? If not, we'll proceed with the roll call vote.
District 1,
Yes.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
and District 5.
Yes.
Okay. Consent agenda passes.
Okay, now we'll move on to action items. Action item number 1, consider accepting the low bid quote for SP 028-606024. Includes paving on County Highway 6. Brian, are you on? Yep.
I am.
It's a nice office to have.
Thanks.
I think we'll keep you there for a while. No, I'm just kidding.
Yeah, so this is our federal paving job on County Road, or County State Highway 6, going from La Crescent to the Winona County line. Project about 7 miles in length, just under 7 miles in length. We bid this out on March 30th. We've been holding this for a while, waiting for the Office of Civil Rights to get through their review on some items. So now we're at day 29 after bidding it out. We're supposed to approve this within 30 days. So we're kind of at that last minute deadline here for approval. We had one bidder. The bidder was Matthew Construction. They came in with a bid at $2,416,084.64. Our estimate was $2,692,582.95. So the bid came in 10.27% under the estimate. Primary reason is the reclamation, aggregate shouldering, and the asphalt were well below the estimated prices on those items, with the asphalt being the big one with the low oil cost. So.
Well, it's encouraging that it's under your estimate.
Yes.
I don't know about that 95 cents versus the 64 cents, so. Really? No, I've been following this very closely too, because I contacted both Jack and Bob Burns about the calls I've gotten from the township officers about the bike, making sure there's enough shoulder for biking and markings and stuff, and the road, the clearage, the tree cutting looks great. I know you talked about that last week. I would make a motion to accept the low bid.
I'd second. Any more discussion, Bob?
With regard to the project now, Brian, you had talked with regard to the 4-foot wide shoulders. Did you talk to any of the township people?
Yeah, so I got an email from the town chairman asking about that, so I relayed that back to them, exactly what we're going to do. So the existing roadway, for those of you that I didn't talk to, existing roadway is 2 12-foot paved lanes, shoulders for gravel. The new project is going to have 12-foot paved lanes along with an additional 4-foot of paved shoulders for the first little over half of the project. That's the section that has the most traffic, most heavier truck traffic and stuff on it. Once that traffic turns off, the rest of the roadway we're going to have 2-foot paved shoulders. So we're giving some additional room for the bikers and walkers, along with farming equipment and other stuff to kind of get out there on the edge of the roadway.
And they were satisfied with it?
Yes.
Second question. I've driven up and down the County Highway 6. All the stumps and whatnot, we just leave those?
Yeah, we treat them so that way they don't grow back with new vegetation and stuff. But yes, otherwise they stay.
So we maintain those shoulders. We cut the grass and whatnot on those hillsides, or only so far?
Only so far. So usually just the ditch bottom and everything toward the roadway. From there, we don't go onto the back slopes very often.
Those slopes, that'll just be tall grass up there in the stumps. I mean, they're kind of ugly when you look at them sitting there, but the grass will cover them up, okay.
So when does that stop there, the bike trail lane? Is that stopped by Bowers there, or Abnet's, or?
Yeah, you broke up a little bit, but I think I heard enough of that. So yeah, that 4-foot paved shoulder stops just after Evans Hill Road. So right by essentially by Abnett Quarry, where that kicks up.
All right. Okay. Any more discussion? If not, we'll go to roll call vote.
District 1,
Yes.
2,
Yes.
District 3,
Yes.
District 4,
Yes.
and District 5.
Yes.
Motion passes.
Okay, now we'll move on to action item number 6.
2.
Number 6?
Oh, I'm sorry. Number 2, sorry. I'm looking at different stuff here. Brian, is this for the annual bid maintenance quotes?
Bridge maintenance quotes.
Yep, so each year we get quotes on some bridge maintenance, repairs and maintenance items on our county bridges. Usually we try to toss in 1 or 2 more bridges than what we maybe have in our budget to do. And then if we get really good prices, we can keep them in there. If we have over our budgeted amount for the year, then we take a couple bridges out to get back to the budgeted amount. So this year we had 6 bridges in our original list. We sent out 4 quotes. When the bridges came, or the quotes came back, we got quotes from 2 different contractors. We looked at the prices and decided we have to remove 2 bridges from that in order to stay within our budgeted amount. The way that we bid it, we can remove bridges as needed to get within our budget. So my recommendation is to approve bridges 28555 on County 3, 28505 on, never mind. Approve bridge 28555 on County 3, 28524 on County 5, 28522 on County 25, and bridge 28528 on County 25. 3 out of those 4 bridges are doing a flood seal on the bridge deck. The decks are cracked up in too many cracks to do individual sealant, or is not as cost effective. So this would do an actual sealant on the entire deck surface on 3 out of these 4 bridges. The 4th one is just some special surface finishing on the bridge to kind of fix up some concrete surface issues. And then I recommend rejecting the quotes for bridge 28505 on County 4 and 28523 on County 25. So that gets us down within our budgeted amount for the year. These 2 bridges that were rejected, I'll probably add them into next year's quotes and try to get them done then. Overall, waiting a year and those aren't going to be a big deal.
Okay, is there a motion to approve the quotes for the bridges we are going to do?
So moved.
Is there a second?
Okay.
Any more discussion?
And for clarification, that's a motion to approve the bids recommended by Brian and reject the ones.
Well, I was gonna do it a separate motion, but
Okay.
to reject, but whatever.
That's fine.
This is for accepting the 4 bridges that we are going to do.
Okay.
Any more discussion? Roll call vote?
District 1,
Yes.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
and District 5.
Yes.
Okay, motion passes.
Then I'll make a motion to reject the 2 bridges that Brian had discussed from this year's work.
Okay.
I'll second it.
Any more discussion on that? If not, we'll proceed.
Back, Brian, until next year?
Yeah, so these we'll probably put them back on next year unless something major comes up that we have to, something with a higher priority. But usually what we try to do is we put $100,000 in our budget each year for bridge maintenance. Once in a while we carry over a little bit of money to the following year to get a bigger maintenance project, or other years we make a little bit less. But overall we try to stay right at that 100,000 each year.
Thank you.
Okay, proceed with roll call vote.
District 1,
Yes.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
and District 5.
Yes.
Motion passes.
Okay. Is that it for you, Brian, or is there something else?
That's all I'm aware of, so I'm going to jump off unless you need me to stay on here.
Anybody have any questions for Brian?
Yeah, Brian, I got one for you. And fluoride, what do we put on? I see you sell 36,000 gallons of townships. And when I put it on at my place, I pay $2.80 a gallon for fluoride. Put on. And on the county roads, that's all you put on for nothing. So if you take $2.80 times 50,550 gallons, that's $141,000 we're throwing away. Why wouldn't we be charging for that?
Yes, that's always been a decision on the board on where we put fluoride and or as far as the cost. The reason why we do it is, there is more traffic on the county roadways, and there is the greater impact of the dust to those residents closer. As far as billing them back, I guess that's a decision that ultimately the board, if they want to bill and collect money, we can.
I don't know, why should I pay for somebody else's? Township gotta pay, so why don't everybody pay?
Yep. I guess I would look at it as on some of the roadways are paved, some of the roadways are gravel. The people that have a paved road is just because the level of traffic dictates that a roadway should be paved versus gravel, and that added chloride is there because the traffic volume is great enough that they are impacted more than maybe on some of these low volume township roads. But ultimately, it really doesn't matter to me. It's whatever the board wants. So if the board would prefer for us to collect a list of who wants chloride in front of their homes and only do those and bill them for it, I'm okay with that. But that's a decision for you, or the 5 of you can make.
Is there any county roads, gravel roads, that we do the whole road, or do we just do in front of houses?
It's basically just in front of houses. There's a couple businesses that we do longer stretches that they actually do pay a little bit to do an extended length. And then I believe we might do 1 or 2 roadways that have a lot more truck traffic on a longer section. But for the most part, it's just in front of the individual homes.
Well, it's a pretty tough year. I think we should be charging people instead of giving it away. That could buy a lot of gravel.
Well, Greg makes some good points there. That's something we should probably look into in the future here. Bob?
That would still be, like what Greg was saying, it's by the choice of the township individual, so it would be by the choice of the county road individual. If they don't want it, they don't get it. If they do want it, they pay for it.
That's the way it is in the township. If they call in, they want it, they pay for it. If they don't, no big deal.
I know in our townships, Houston Township, we don't charge residents for that dust control, so township pays for that. I know it was discussed on whether to charge the residents for that, and we, I guess, ended up thinking that, well, it's a service that we should provide to their residents of the township. So, but I know some townships like Greg's in Wilmington there, they do charge their residents for that. And I'm sure there are other townships that do too.
A lot of them have their own rules how they do it. We pay $50 towards it. Everybody that buys it, we pay $50.
So the township, you mean?
Yep. If I get billed $280, the township rebills me for $230. I get a $50 rebate.
Okay, all right.
That's how we do it in our township. Some of them are different.
Yeah.
Nego has mostly county roads, so they don't have to do too much with it.
Yeah.
But that's an awful lot of money to be giving away.
It's a service, you know, it's whether we've got it, you know, that'd be something to look at if we need to, find some ways to save some money and cut some costs here coming up.
Well, I mean, I paid mine. I think everybody else should have to pay for it.
Okay.
Depending on the township, I mean, it's like you said, some townships pay for it as a service, some townships charge the residents that want it, so. Townships and their residents.
I'm sure every township's budget is different too, so some townships probably can't afford to do it, some can.
Yeah.
Brian and I will take a look at what that would look like and get a proposal ready for the board to consider.
Okay, thank you.
Sounds good.
Likely would cut the amount of chloride we put down.
Well, I mean,
Yeah.
a lot of people don't like chloride either. A lot of people don't like it on their roads because it wrecks the roads.
Yeah, planning wise, it'll take a little bit of planning to figure this out if the board does want to go that direction, because we'll need to get notices sent out to everyone. They'll need to respond back if they want it or not. We'll need to figure out how to collect that payment and when that payment comes in, and we also need to bid it out with those quantities done well in advance. So, you know, we're looking at a pretty lengthy process to make that change. Very easily to make happen if the decision's made, you know, in the next few months for next year. This year, the contract's already in place. We're getting that chloride. It's really tough to. We're locked into set quantity. We could store it, but there's, you know, some decisions that need to be made first and some planning. So, but it can all be done.
How soon, Brian, were you planning on putting it down on roads, starting that?
I think the plan is the first full week of May is when we're hoping to have the first delivery that Monday. So usually we do it in early May. Some years it's not done until June, depending on what we're doing for gravel. But
I know, if we do this charging people, I know we're gonna get people saying, really? I gotta pay my taxes, plus I gotta pay to get my road dust controlled? That's ridiculous, you know, but.
How about the people that gotta pay for it?
Yep. I hear you, Greg.
I mean, I don't mind paying, but I don't wanna pay for everybody else's either.
Mm-hmm. Okay. Anything else for Brian? All right. Thank you, Brian.
okay, thank you.
I'll move on to discussion items.
No, we've got the extra action item.
Oh, I'm
Yep.
sorry. That's.
Yep.
You want to explain that, Jeff?
Yeah, absolutely. I'll just introduce it again. We're looking at one of the options underneath the federal Families First Coronavirus Response Act, the FFCRA, is the exclusion of employees that are essential to operations. And so we're looking at the employees of the county's sheriff's office, excluding them from the paid sick leave and expanded family and medical leave provisions. And I'll let Tess jump in and discuss that further if there's.
Yes, and thank you, Jeff. And good morning, commissioners, and welcome to the new Commissioner Myrie. And please feel free to contact me should you have any questions as you start your tenure here at the county. We're looking to only include at this time for the sheriff's office employees those that are members of the law enforcement units, which we have 3 law enforcement units, as well as those who are members of the law enforcement unit for jailer dispatchers. Let me qualify that. We don't have 4 units. We have 3 in total. So we are not including any of the AFSCME positions. So the positions of the Emergency Management Director, would be excluded from this, as well as the 2 clerk tech positions that we have in the office. The reason for the request to exclude them from the Families First Coronavirus Response Act is because we are minimally staffed according to the Department of Corrections regulations for the jail at this time. We do have acceptable levels of staff with overtime, if you will, to cover for sick leaves and with appropriate planning for vacations that may come up in the future after this crisis is over. But right now we don't have the kind of staffing levels that would afford us the opportunity to say give somebody 12 weeks of leave. We have to make that up somehow, and we would not be able to do that. And likewise, on our deputy side of the house, we need those deputies for public health and safety right now as well. So yes, Commissioner.
I have just a question to understand this. Is this similar to prohibiting, say, teachers from going on strike, or any other public employees saying no, you're essential, you can't strike? Is this a similar type of restriction?
I guess you can look at it that way, but it really isn't for the same. It is for the public benefit. I mean, we have to be able to run the detention facility, and I'm not sure if the sheriff is on this call or not right now. He may be able to speak better to that. I know that for staffing, from an HR perspective, we have certain minimums that are dictated by the Department of Corrections that we have to meet, and we are not allowed. We would not be meeting those if we were to say have potentially a crescendo of those that would qualify for this. If you were to determine at some time later that the county were able to include these groups in the FFCRA, you could always do that at that time. But the sheriff and I have met on this at length, and I've had discussions with the administrator as well. And we're recommending this at this time. We can't pick and choose who gets, say, well, we'll allow some of them up to a certain number. We can't do that. You either have them included or you have them excluded. And so we're recommending that they be excluded at this time because of the public safety and DLC regs.
So why is this coming up now? Is this an after the fact?
We have discussed it. Good question. We have been discussing it for the better part of 3 to 4 weeks, whether to do this or not do this. And yes, we need to.
Who's we? Are you referring
the sheriff and I, and the county administrator.
And I would say that we've held off on this. It was something we considered initially when the act came out. We held off because I didn't want to take the flexibility away from Mark and Tess on working out what was best for employees and for getting work done. As we look at what's being done in other counties, as we look at how people are starting to interpret these new rules and the new programs, it would be better that we implement this exclusion, and then we will continue to work with employees to balance things out. But with it as is right now, we, as she said, we could have a cascade of multiple applicants, and we could be without an entire section of critical employees to keep the jail and the detention center and the deputies occupied.
Well, we could be in that same situation with other departments too, could we?
Yes, potentially, but I think from a broader perspective, we've got a little more flexibility with manning, and then we have the ability to, if we had that happen in another section, we have the ability to look at whether or not we continue to offer that function or how we respond and adapt to it. Whereas with the detention center and the deputies, we have less flexibility on bringing in temporary help, turning something off, etc. So we don't have the flexibility there to be as responsive.
Actually, I don't. In the.
Bob, you got a question?
Oh, I'm sorry.
Justin,
In the jail facility, bringing in temporary help, it's been my experience these last 10 years. There is no flexibility there because the background checks and the training curve, learning curve is so steep. You're talking weeks, weeks upon weeks.
Just refresh me. What is it that we're excluding from them? What can they not do?
Oops. I'm sorry, my screen just went to sleep. Just a moment, please. Well, we will work with them for if they have a leave request. Of course, we're not talking about them being ill and we're requiring them to come to work, but we are excluding, the request is to exclude them from the 2 weeks paid sick leave and the Families First Coronavirus Act expanded FMLA leave for the purpose of care for their children, that they have to find alternate resources. Now, in the state of Minnesota has, because many communities have excluded these groups, they are able to take their children to their local schools and school districts for care. We would be working with our employees to try to change shifts to work around their family needs to get them the time off they need, but it wouldn't be pursuant to this statute, which would basically dictate potentially 12 weeks of leave. We would be actually working with them to get a workable schedule for what works with them, for them, excuse me. And the sheriff has, I believe, is very committed to do that to the best of their ability.
So they're going to be excluded from that 2-week paid sick leave that was brought up?
For this, yes.
The federal.
And that is how, that's my understanding that other agencies around the state are doing the same thing because of the critical role these persons play.
Are the unions going along with it?
Well, we haven't talked to the unions about it because it's not a union decision. It's strictly your decision.
How does the sheriff feel about this? He's not on, I assume.
The sheriff and I spoke this morning. We spoke last. This is something that the sheriff is encouraging the board to take action to do.
Yep.
Okay.
Yeah, sheriff is fully in support of this, but conversely is very interested in working with his folks as much as possible.
As much as possible.
To make accommodations as long as they can, keep the required number of positions working and covered.
The sheriff, I believe, had thought possibly this had been done at an earlier date. He's very supportive of it because I'm repeating some of the things over, but for instance, we discussed how do we meet DOC staffing regulations, and also the critical role that the deputies play.
And all the other municipalities or counties in the state have done this, or are there just a few?
Commissioner, I can't say all and I can't say a few. I'm saying it's my understanding it's common. I haven't done tallies on it. And the legislation provides for this because of the anticipated need to have these folks on duty.
So who brought this to your attention first? Was this something that the sheriff brought up, or is this something that you or Jeff thought of, or I'm just trying to figure out how this all came about.
Well, I think I would say
Sheriff,
it's
I would
something
say.
we've discussed and looked at when the act first came out, and how to apply it, to specific areas of the county, and so I guess it's been a topic as long as the act has been out, which hasn't been long. And of course, when the act came out, there was multiple interpretations of what it meant. DDA, that is on contract with AMC, was reviewing it and has provided interpretations. The Tess has been in contact with who we've used in the past for labor attorneys to see what the interpretations are, and with the state offices to discuss those interpretations. And so I think some of it is a evolving knowledge of the program, some of it's evolving knowledge of how it affects us and the ramifications of applying it.
And may I add, the Department of Labor, the Federal Department of Labor I'm speaking of, on their website has a Q&A, and has also under question 57, I believe that, I don't know if that was forwarded on or not, specifically addressed this later on in its guidelines after they passed the legislation. And in anticipation of this question coming up, it is a common question. I spoke with the attorney we've used for employment and labor law in the past, and a number of counties are doing this. I didn't ask her how many. A number of counties and municipalities are. I was told that for the ones that delayed in their exclusion were having difficulty because the way that they also all of a sudden are not able to staff at the levels they need to be staffing at, and they regret not having taken their sections earlier.
So where's the funding going to come for this, or isn't there no, or how does that work?
This does not have a funding tail. The exclusion, the action to exclude, does not have a funding issue.
This is just strictly exclusion from the FFCRA.
Correct.
So you're looking for a motion to approve this?
Yes, Commissioner.
I would so move.
Is there a second? Is there a second?
Teresa appears to be trying to. She's muted, though.
She's muted.
Let me confirm that's what she's...
There you go.
I'll second it for the point of discussion.
Okay.
But I do, as a matter of discussion, I wish we would have had information on this before our action item today.
Mm-hmm. May I also give you a little more information? You know, it is possible that if you exclude them at this time, that the county could then, we could look at coming up with some kind of internal policy that just, with our union groups, that just addressed these groups as to how we may want to potentially move forward with them, so that they are not terribly adversely impacted, or there wasn't some unjust result. So that doesn't prohibit us from doing that ourselves. This just protects the county at our staffing levels for these critical positions.
Well, I do share Teresa's concern that this is something that we would like to more of a heads up on instead of last minute.
Mhm.
I think we should table it for now and have a little more discussion on this, get a little more details on it.
Well, we've already had a motion and a second.
I would just add that I'm not really sure what a big issue. I mean, we have frontline healthcare workers that some are dying and some are working 12-hour shifts, and this isn't draconian. I mean, it's necessary. This is the last thing we need in this situation is to try to staff something after we've let people go on a leave that isn't absolutely necessary.
Yeah, but they can't take that leave for anything other than that they have a spouse or a child who has the COVID. So, I mean, this isn't just a willy-nilly 2-week vacation here, you know.
Well, it's not just for that, Commissioner. I mean, if they're exposed to COVID because they have a member in their household that has COVID, we will be giving them leave because we do not want that exposure coming into our workplace.
But they'll be denied the 2-week sick leave.
We're talking about, but we have other leaves we would be able to trigger. We're talking about the 12 weeks of leave because schools are closed to care for children. The way the statute is written is it says that there's no other I'm trying to think of the adjective that they use, but no other appropriate adult to care for the child in the household. Well, that has, by some in the Department of Labor, it is interpreted as totally in the employee's prerogative to determine, which I understand that, who's appropriate and who isn't, but that could basically even exclude other parents. We would be opening up that anytime someone who's a parent asks for of a child whose school has closed or daycare has closed, that we would be automatically triggering potentially 12 weeks of leave. And that is something that the sheriff and I have really talked about as to whether we can really do that. I'm not saying we've had people ask for that, but potentially they could. And with your frontline workers like this, it puts us in a very difficult position.
I would add additionally that the sheriff's in favor of this, and it's his department.
Well, we are taking away one of their rights.
It's management's authority to determine their staffing. It's not their right. It's potentially a benefit. I don't know that I'd respectfully refer to it as a right, but it is a potential benefit. And like I said, the sheriff thought we had already acted on this, but we had not. We had taken a wait-see.
So he was under the assumption that this was already acted on, but there was a wait-and-see attitude, or?
Well, I think I don't know if he thought it was acted on or if he thought it was inherent in the rule when it came out. But his impression was that it was already an exclusion.
Mm-hmm.
And we didn't specifically take action to make it an exclusion, and that's what we're asking for now.
Because we're waiting for guidelines.
Mm-hmm.
Guidelines and advisories.
We're waiting for guidelines?
We were waiting for guidelines and advisories.
And we have received those guidelines.
Well, question 57, when they supplemented the questions on the DOL site, that was very helpful. We've also received further clarification as we talk to our legal advisor.
Well, the motion's been made and seconded. Is there any more discussion? If not, I guess we'll proceed with roll call.
District 1,
Yes.
District 2.
I don't know. I wish the sheriff would be here just for, I like to have his input. So I'm just, given the fact that I'm being told that the sheriff's okay with this and this is already a done deal, I guess I'll say yes.
District 3,
No.
District 4,
I'm saying no only because I needed more information.
and District 5.
I'm gonna go no until I get a little more information.
All right, so motion fails.
If we could get the sheriff on the phone, would that be helpful?
Ooh.
Yeah, that would have helped a little bit, I think, to hear from him.
Would you like to hear from the sheriff now?
I actually have a funeral to attend to today at 11:30 or shortly after, so I'm not going to be here too long.
Okay.
So,
11:30.
Mm-hmm.
Okay.
All right.
Thank you.
We will provide more information.
All right.
Okay.
Teresa, you want to start with, no. So if you have to leave, Teresa, we can go to commissioner comments quick.
yeah, I do have to leave pretty quick. Nephew passed away, and there's a lot more to the story than that. But anyway,
Let me interrupt. What about committee appointments? Can we put that off then?
We could put that off until the next workshop. How's that?
Okay.
Is that fair enough?
Because you were leaving, I wanted to make sure.
yes, because actually I only had one committee that I was willing to pass on to our new commissioner if he was willing. So that was, and I did run off a copy of it, but if you want to wait till the workshop next week, that's fine with me, because it's not a motion thing, it's just a matter of discussing.
Okay.
We can do that. That's okay with everybody else.
Yep.
Okay. Sounds good. I had two major meetings, well, not major, they're all Zoomed out. So, but one of them was my policy and public safety meeting, and of course it's very much concerning with the Department of Corrections and how they're trying to work with the youth, and it's really challenging time right now. And also our jail inmates, going to home monitoring, finding drug testing availability, using schools and alternative places to put them in, and basically trying to rehabilitate prisoners rather than housing prisoners. It was quite an involved meeting, and I can elaborate on it if you want at our workshop. And then I did go to the AMC webinar yesterday with Governor Walz, and it was just for county people, and it sounded like there were quite a few county commissioners on this. And there again, I brought up about the local public health being able to do either testing or tracing, that kind of thing, monitoring. Also, he did bring up that they're working on the bonding bill because counties really do depend on the bonding, especially for our roads. And I think that, Bob, you were on it too, weren't you, Bob Burns?
Yep.
So you could probably elaborate on that. Also, I have had a couple calls, and I think Jack has had the same calls from people in La Crescent Township. And I did contact Aaron to follow up on that one too. And I did contact the person that called me about Wildcat Park and about getting his trailer down there, and I told him without hookup and to call first. So he's gonna move forward on that. That's basically what I've got.
Okay. Thank you, Teresa. We'll move on to, Greg, you wanna bring something up, commissioner comments?
Well, just about the chloride was what I was gonna bring up, and then, I guess, for right now, I guess I don't have too much. Some zoning maybe issues we can discuss. I've had a lot of phone calls on, taxes. That's something we gotta look at too down the road. I mean, I think everybody's getting them. Just that I can't believe that we can have that many problems in that office at one time. So that's something we gotta look into too. That's not all for me.
Okay, thanks, Greg. Jack?
Sign off. Thank you very much, and we'll see you next week.
All right. Thank you, Teresa. Jack?
Yeah, just, I was on the webinar. I've been communicating by email with Hiawatha Valley, keep getting updates, and anything of importance is being sent, and opportunity to reply or agree or disagree. Other than that, nothing of any significance.
Bob?
Yeah, on Hiawatha Valley, are they gonna be ready to move?
That's the latest, yeah.
I mean, I see things actually taking place in the building now.
Right. It's action.
Is that the one by the Artist?
Yep.
Yes.
Suddenly a flurry. Is it my turn to talk?
Yes, it's your turn, Bob.
The most recent webinar that I went to was the AMC Transportation meeting. It was a very good meeting. I mean, they had some good speakers and they talked about oodles of things. But the biggest thing that they have on concerns, one was the reduction in gas tax and sales tax. This year's budgets are in place, so they're not going to change. It might have a bearing on how much, you know, the surplus turns into a deficit, but they are concerned about what that's going to do to next year's and upcoming year's budgets. One thing that they brought up also was the broadband funding. They had asked for $30 million. That was the difference that they needed to get the work done for last year, and or this last biennium, and the budget was cut from the $30 million that they requested to $20 million, just as a budgetary cut point of view, I guess. But so the broadband isn't going to be as quickly put in place as they had hoped. And the last thing that I found really interesting, they had talked about a municipality that had a project that they wanted to do, and they put their project together and put it out for bond, to get bonds on it, get bids on the bonds, and they didn't get any bids. Because of the way the economy is going and whatnot, they didn't have any bidders for their bonds. So it makes a concern for me as far as this highway department building and that project. If we have to bond for $2 million or whatever, if we're even going to get somebody that'll bid on the bond, that's a big concern as far as I can tell right now.
Yeah, I could see that being a big concern, and everybody's fearful for the future here and what's going to happen in our economy. And I could see this gas tax money just drying up from the lack of use of it. I mean, nobody's going anywhere as much as they used to, and yeah, it's dire times ahead, I'm afraid.
We just got a $50 rebate on each of our cars for insurance because of less use, which Was,
The wrong insurance policy.
Yeah, I was gonna say that.
What company is that, Jack?
Bam, but it's about time they sent me something, I'll tell you that.
Don't you get that bonus for being a good driver?
The other thing I was gonna report, we got the quarterly report for the first quarter of where we were on expenditures through the county, and I went through that. I had 2 pages of questions, but everybody gave me the answers as to, why we're in excess of the 25% that they should be at as far as the expenditures. Some are annual payments paid early and whatnot, but some I didn't understand, and they got me the answers. We're just gonna keep track of those line items and see if they start falling back into line.
So right now, we're at the first quarter, we're over.
We're not over, but certain line items are considerably over compared to when I looked at them, what I thought as far as items that were being purchased and whatnot.
Okay.
That's all I've got.
All right. I don't have a whole lot either. I've been spending most of my time in the last week or 2 in the field, so been kind of busy. But my phone still works, and I still been getting calls about their evaluations on the rural preserve acres, and some people not getting their homestead credit. So this is something, like Greg said, we have to look into and see what's going on there and making sure all this gets corrected.
Question for you then, Eric or Greg, with regard to the farm economy, they talk about dumping milk, they talk about crops that are going to waste and whatnot. Are the prices going down the drain on everything?
Yep.
Pretty much. I mean, the cattle are down, milk is way down. I mean, $11, we had that 30 years ago, $11 milk. And now they're supposed to operate now. It ain't working for nobody right now. It's gonna be tough.
Eggs are up.
What's that?
Eggs are up.
At the store, but there's a interesting dynamic going on with the egg situation. There's a big demand for the whole egg, but 80% of the industry for eggs is liquefied eggs, or liquid. And with the fact that the restaurants are out of running and stuff, there's a lot of layer hens that have been euthanized because of this, because they can't get rid of the eggs, and they don't have enough crates for all the eggs. So this whole food chain thing has gotten disrupted and blown up, and with the beef plants shutting down and pork plants, it's going to be a mess.
I saw a picture, I think yesterday, of thousands or hundreds of thousands of chickens just being killed because, like you said, I guess they can't feed them or can't get rid of whatever the situation is, but
you can only make so much chicken soup.
Well, when you got these big chicken operations, they have like a load of semi that goes about every 2 weeks. Well, now they can't even get rid of them semi-loads of pigs. So they got to sit on them, and how long can they sit on them? That I don't know. Same way with beef cattle. They can't do nothing. People have got to go to the bank and borrow money because they have no cattle to sell to pay for the crops. So it's getting pretty tense out here right now in the country.
Yeah.
Well, once they allow restaurants and stuff to open up, there won't be any product for them to buy.
It'll take quite a while to restock everything. I mean, it ain't gonna happen overnight, because right now all the cold storages that I know of in my business, they're all pretty well empty. We're getting right down to where they ain't gonna be able to send any to the stores pretty quick. Unless, I heard today that a few more packing plants are starting to get going in the right direction, so. Could be 2-3 weeks, maybe a month, maybe before the meat situation gets back to normal.
And the prices that the farmers are getting, all this is based on fear. I mean, isn't true reality of demand, supply and demand, it's fear. And so it just drives it down.
Well, if you look on the board market, on the board up in Chicago there, cattle are like 85 cents. Well, the cash market as today is probably around 95 to $1.
Mm-hmm.
Some of the board, what you see on the Chicago Board of Trade ain't always quite right. The cash market runs sometimes over the board, and then sometimes it runs under the board. So, and right now it's running over the board because of the demand, and we don't have it.
Yeah.
The beef are out there, but we can't get them processed. And the more processors we get going, then the price will probably creep up.
So, hence, with all the situation going on, farmers look at their evaluations, or they see it doubled, and they're not happy.
Well, I mean, if they're getting $5 for their corn and $1.20 for their pigs and $1.40 for cattle, they probably wouldn't say too much. But
Exactly, yeah.
Well, you know how it is, $2.95 corn, you ain't making no money.
No. I don't even know why I'm even planting it, so.
It's because you're a farmer.
That's all I got. I just wanted to ask you what that was at.
Yeah. Jeff, you have some administrator updates?
Well, I guess nothing critical based on looking at the clock here. Have other meetings to get to as well. Yeah, mostly plugging away. We are looking at the driver's license center and working with staff on what the reverse of what we've done will look like as we open things up. How that will look. We're looking at where we can put some physical barricades in, plexiglass shields around the driver's license desks, that kind of thing, and how getting back to normal will look, and what the new normal will look like. So we're working towards those and having those discussions. Most everything is plugging away pretty well. We are seeing quite a bit of workload still in the documents coming through. There's a lot of house sales, refinances especially, seeing a lot of documents come through a recorder's office and the auditor treasurer's office. And then, of course, the driver's license center is busier with dealing with things over the phone, dealing with things by mail. It just makes the process harder for us, and it makes the process harder for customers. And because other places are closed, we're just seeing an increase of volume in that stuff. And so the ladies are working pretty hard downstairs to get through all of that.
It reminds me, I got an email from Cindy about the possibility that they won't be able to do appraisals this season because of the COVID situation, or?
Well, yeah, they're getting some guidance about that. We're looking at how we can work around and work with the social distancing requirements and travel requirements and stuff. So something will be possible. What that looks like yet, we're still evaluating.
Okay.
And again, one of the things we're looking at is the possibility of shifting focus, and we obviously don't have to have a lot of face-to-face contact to go out and do all the agricultural properties and fields and that type of work. So those we can refocus on some of that and knock out numbers of properties that way. So, yeah.
Well, yeah, the only situations would be if you were to wanted to go into the house. That would be a
yeah.
I just saw that email come across, so I was just curious if any more discussion on that. So.
Yeah, we've got the pictometry software that we have that feeds down to Beacon to give us the imagery. The contract, they've asked to delay that flight for us this year. They're still flying, they're still taking pictures, but with the trade-off of delaying their flight, they've offered us a higher resolution image at the same cost, so we're getting a little bit of a better deal there. It's a little bit of trade-off. We'll have more foliage on trees and stuff when they shoot the pictures, but with the images that they shared anyway, the resolution that we get with the cameras, I think more than makes up for it. But with that new contract, the last time they flew set the baseline of property dimensions, and so when they fly this time, the software is able to pick out and tell us if the footprints of buildings have changed or not. And so that will give our assessor and our zoning officer, you know, a list of things where, here's where things have changed, and that'll help us focus a little bit on what areas we look at with reassessments and such.
So we better hide our junk under the trees and stuff? Is that what you're
A
saying?
little more camouflage over those 10 new sheds you have hiding out back, yeah.
Okay, all right, yeah.
Yeah.
Anyways.
Okay, is there anything else?
I'll move to adjourn.
Is there a second?
I'll second.
I don't think we have any public. Could just verify real quick that we don't have any public with a public
Is
comment.
there any other public comment? No?
Okay. Thought I recognized all the phone numbers, but just in case. So Burns moved. Who seconded?
Yep.
Who did?
Right, yes.
Great. Okay, perfect. District 1?
Yes.
2? Not.
Yes.
3? Not here. 4? No, not here. 4. And 5?
Yep.
All right. Approved at 12 o'clock.
All right.
Off to my next meeting.
Thanks, guys. See you later.
Same here.
Have a good
Have a good day.
Thank you, guys.